GC.
Stitch.
Pull the tubes out.
Course V-fib.
Hi, my name is Annie Onishi.
Annie is a surgical resident at Columbia University.
Today, I'll be breaking down clips from movies and TV about the emergency room and the operating room. Again, roll the clip. Cardiopulmonary bypass. The good doctor.
The valve doesn't have adequate support. It won't be able to close.
Cardiopulmonary bypass is a technique to allow the heart to stand still, to allow surgeons to operate on the heart, while a machine takes the blood out, puts oxygen in, and puts the blood back into the patient.
Stitch.
5 hours, 23 minutes.
While it's great to allow the heart to stand still so the surgery can be performed, bypass has some downsides.
The patient died.
The longer you're on bypass, the more likely you are to have bleeding complications, the more difficult it is to restart the heart after the operation.
Pump time.
6 hours, 48 minutes.
6 hours and 48 minutes is an obscenely long bypass time.
How long has he been on bypass?
Bypass times in reality range more along the lines of 45 minutes to 2.5 hours.
Nearly 2 hours too long.
Hollywood rarely gets a good representation of what bypass surgery actually looks like.
Damn it.
Self-extubation. The Sopranos.
4 milligrams out of van.
He pulled his tubes out.
Self-extubation is when a patient removes his or her own endotracheal tube, which is the tube that connects the patient's airway
The airway box.
to the ventilator, which is the machine that's breathing for them. It's actually not as hard as you would think to do that.
Well, that's good, right? That means he's breathing on his own.
Little old ladies who you'd think never in a million years would be able to do it can do it. This tends to get everybody very excited in the ICU
Take the family out.
Please wait
Where's the other
outside.
because in those moments, the patient may not be able to protect his or her own airway.
They had to put the tube back in.
Face transplant. Face off. My first thought is, oh my God, you can't use cautery on the skin like that. That's very poor form. It can leave burn marks. It's just not really the technical way we make skin incisions. The other sort of suction cup device, while it looks great on camera, in reality, a harvesting of facial structures would take hours and hours and hours as the surgeon very carefully removes muscles, arteries, veins, nerves, and the like. Face transplant has really come a long way, initially described in France, and has been successfully completed here in the United States in a number of patients with devastating injuries to their airways, their mouths, their eyes. It's really not a cosmetic procedure at all. It's life-changing and life-saving for these patients who otherwise can't live normal lives.
I'm here today because I want others to see that there is hope beyond the injury.
Old school defibrillator paddles, chips.
We have course V-fib. Let's get an amp of air purification right away. To increase the ventilatory rate.
Show me those chest compressions one more time. Those are without a doubt the weakest chest compressions I have ever seen.
Well, no wonder we're losing
If
it.
you're not sweating giving chest compressions, you're not doing it right.
Stop CPR, please.
So they say that this patient has coarse V-fib,
Course V-fib.
which is a type of ventricular fibrillation, a rhythm that will require a dose of electricity.
Let's hit him with the paddle. Set it for 280 and give him to me.
As you can see here, they're also taking their dear sweet time getting the pads on the patient.
Ready at 280.
Hollywood loves the manual defibrillator paddles. I think it gives the doctor something to do on camera. In reality, it's really these stickers that are used more commonly.
Are they sure?
Double checked it.
Let's take a look at scrubs.
Don't worry about the patient. Turk was already there, learning by doing.
These days, modern defibrillators are pretty idiot-proof. They have a technology that senses what the patient's rhythm is and will deliver a shock only if indicated. Dr. Turk here, he's using an older school defibrillator that's not obviously sensing that the patient is just asleep,
Turns out the guy was just sleeping, attached to a faulty monitor.
and he is able to deliver a shock even though it's inappropriate. Again, seen in The Thing.
Clear.
I hate when that happens. A professor in charge of his own heart surgery, Chicago Med.
Give me a 20mm Dacron graft and a 3/0 Proline stitch.
No. 3-0 is far too heavy for a graft this size.
It's pretty unrealistic that this person wouldn't be sedated just a little bit.
Did I fail to teach you proper surgical technique?
Definitely not able to participate in the goings-on of his own open heart operation.
I thought the 3/0 was appropriate.
That's it. You're out.
If we're gonna get real technical though, I do kind of agree with the crotchety old guy. 3/0 suture is a little bit too big to be sewing on the vena cava with.
Do not touch me with that torture device.
Flatlining. POPSTAR.
I love the road. You know, this is kind of a perfect job for me, but my favorite free time thing is flatlining.
Heart rate dropping.
Flatlining is when you technically lower your heart rate until, well, you're dead.
What Bill Hader is describing here as flatlining is what we in the medical field would call asystole, which is complete cessation of all electrical activity in the heart.
You can catch a glimpse of the afterlife.
I really would not recommend to viewers that they try to pursue this hobby.
I try to fit in a F-line sesh at least once a week.
One thing that's inaccurate in this clip is that asystole can't actually be reversed with a shock. It's one of these sort of unshockable rhythms. It would need to be treated with infusions of certain medications like epinephrine.
Oh, wow. My pants.
Not this time. Fun fact, I do suppose it is possible for you to poop your pants while you're in asystole. Steel magnolias, withdrawing of life support. So I actually think this is a pretty fair representation of what happens when doctors remove life support. One thing that they get right here is that we do turn off the monitors so that there's very little noise or distraction. It makes for a much more peaceful environment. Farting in the OR, scrubs.
Good. Good. Whoa. Whoa, what's that smell?
I don't know. Sir, I farted.
Get the hell out of my OR.
Yes, sir.
Look, I'm gonna get real with you right here, right now. If farting in the OR got you kicked out every single time, neither me nor any of my co-residents would ever graduate from residency.
Dude.
Self-surgery, master and commander.
We'll have to raise a rib. Right? And
So as crazy as this sounds, self-surgery has actually been documented on a number of occasions. This badass Russian surgeon, Dr. Leonid Rogozov, actually removed his own appendix while he was stationed by himself in Antarctica.
is that all of it? Hi, sir. She'll patch up nicely.
Here's another example of self-surgery in 127 hours. So here we have James Franco playing Aaron Ralston, self-amputating his arm after being trapped in a canyon for a number of days.
As the boulder ricocheted, my right hand became trapped by this rock.
I think this is a pretty fair representation. It's actually hard for even me to watch. His use of a tourniquet in this scenario is very smart, probably life-saving. Unfortunately, in today's day and age, a tourniquet is something that everybody should know how to use. I think they do a pretty great job.
Thank you.
Crush injury, Grey's Anatomy.
What's that?
Pouring vinegar on your flesh to minimize the burns inside your skin caused by the cement.
Burning from the inside out? I'm dying, aren't I?
Hey, Andrew, I'm banning that word from your vocabulary.
So this is actually a very good, very creative representation of a crush injury in something called a compartment syndrome.
What?
Compartment syndrome is when there's some sort of pressure on the abdomen or actually from within the abdomen that's preventing blood from returning normally back to the heart.
Oh, God.
And the second they remove that last piece of stone, all of those toxins that have built up rush back to the rest of the body. He goes into basically immediate cardiac arrest and he loses consciousness.
Easy, easy.
One minor nitpicky point though, if they knew all of this was gonna happen, I think they probably should have intubated him, secured his airway before they removed that last piece of rock.
Yeah?
Organ transplant, John Q.
Heart.
So this is pretty accurate. Donated organs actually do end up in the OR in 2 plastic bags full of ice and ice water, which is represented here. That plastic bag goes in another plastic bag, goes in a special bag, goes in a special box, goes in a special cooler, all taped up with real special tape. And again portrayed in One Tree Hill.
Dr. Pastor.
I mean, that sucks.
Nurse Henderson to admit.
And we always double bag for safety. The dangers of patient transport, Grey's Anatomy.
We're gonna find out who this little guy is.
Sorry, I'm so sorry. Those stretchers are very heavy and very hard to control. I have definitely, on a number of occasions, had my foot run over by one of these things.
You do any more bowling for doctors today?
I've been hip checked by either an anesthesia resident or a patient transporter.
Try and take out Kepner.
I would say this is a pretty accurate representation of the amount of sass that flies around an emergency room.
That'll work too.
Here's a better representation of an incoming trauma from Chicago Med.
Female mid-20s, GCS3, struck the dashboard and starred the windshield.
Here you can hear the first responders reporting to the doctors that this patient has a GCS of 3.
GCS3.
That refers to a Glasgow COMA scale. The Glasgow COMA scale measures your mental status on a scale of 3 to 15. You and I, sitting here talking right now, have a 15. A carrot has a 3. 15, 3.
There he goes.
In-house hospital translators. Getting on.
See if maybe we can just tell them what she's saying and then they can translate it for us.
We're gonna try to tell you what she's saying.
Yikes.
This
is really bad. This is a huge violation of this patient's rights as a patient.
That's gotta be something.
Did you get that?
Every patient is entitled to an interpreter who speaks his or her native language fluently in any medical encounter.
He says, she says, I can't stand this. I wish I was dead. Please kill me.
Last time we talked about removal of live ordnance from a human body cavity, we were talking about downtown Seattle Grace. Here, we're looking at a field hospital during the Vietnam War.
Kid comes in with an unexploded grenade that's been shot into his body.
This is not something we typically learn in medical school or routine surgical training.
Something they neglected to tell us about in med school.
Usually these operations have to occur in a field hospital well away from any other personnel that could get injured when and if the ordnance explodes.
There must be an easier way for a surgeon to make $413.50 a month.
First, they would use an x-ray to sort of figure out what kind of unexploded bomb would be inside the patient before very carefully and under very controlled circumstances removing it.
Boy, this is one hot potato.
Old school scrubbing in, the KNICK.
You can waste your time scrubbing in if it suits you, but I told you, your role is to talk Gallinger through the procedure. Nothing more.
Germ theory really became more widely accepted in the early part of the 20th century. So here you can see this surgeon dipping his hands in a series of what looks like iodine solution to clean his hands before an operation. These days we use a simple rub-on alcohol-based gel very similar to Purell. Small talk in the operating room. St. Elsewhere.
Who here smokes?
Dr. Ehrlich smokes.
Figures. You smoke, Louise?
Not so much as a puff.
Like any other workplace, we talk about weekend plans, we talk about the weather, we talk about politics, you name it.
140,000 hits of nicotine a year for at least 15 or 20 years from the looks of this mist.
We never gossip about the patients. You never know what they can actually hear.
Moron.
Breaking bad news. Contagion.
She failed to respond. Okay. And her heart stopped, and unfortunately, she did die.
Okay.
Communicating bad news with patients is one of the worst parts of our job.
Right.
One thing that this doctor does that I'm not crazy about is just speaking to the distraught husband in the middle of the hustle and bustle of the emergency room.
I just saw her. We were just at home.
Another thing to avoid is technical jargon, such as failed to respond.
She failed to respond.
In a state of high stress, patient family members are unable to process beating around the bush.
What are you talking about?
So the doctor then does a good job of saying your wife is dead.
Your wife is dead.
During medical school and actually ongoing through residency, every once in a while we will work with paid actors who are able to simulate these sorts of very high stress emotional situations.
What happened to her?
Okay.
This is definitely how you don't do it.
How's my son?
He's going to be all right.
Oh.
Thank God. Yes, he's lost his left hand, so he's going to be all right.
You son of a bitch!
In my experience, there's really no place for puns in the hospital.
That's more the way I would take the news.
Dangerous patients. General Hospital.
Someone help me, please!
I can hear you.
Help! Please help me!
So those are called 4-point restraints. They're on the spectrum of the most extreme sorts of restraints that we would need to use for a patient. There actually are 5-point restraints, which also involve a vest.
Someone hasn't been taking their medicine.
Sometimes psychiatric patients or patients in an ICU do need to be restrained.
I need some help in here!
For their own safety and for the safety of the hospital personnel around them.
Let go!
And here's another dangerous patient in Thor.
How dare you attack the son of Odin!
I need some help!
And sometimes we do have to do what's called chemical restraint. That's given intramuscular injection of something like Haldol, which is an antipsychotic medication.
You're no match for the mighty!
Pretty accurate. Bullet wounds. Game night.
Step 1, sterile gloves. Check. Step 2,
Disinfect wound.
Right, yeah, that's gonna sting, isn't it?
I wouldn't necessarily recommend using wine as a disinfectant for an emergency backdoor surgery, but I guess between the acidity and the alcohol content, maybe it could work.
Aren't you small, baby?
That's not small. That's really big.
In my opinion, the bigger the incision, the better it is. You're more likely to be able to see stuff, and anytime you're struggling, just make the incision a little bigger.
It's a bullet, not a grapefruit.
So the entire premise here that you have to remove a bullet just to take a bullet out is not exactly accurate.
Shh. Quiet. I know what I'm doing.
There's plenty of people walking around out there with bullets stuck in their bodies in various locations that aren't really causing any harm at all.
Max, did you get shot twice?
She must have skipped step 0, which is make sure you can't also find the exit wound.
That's the exit wound.
Oh, it came out.
Yep, nothing to remove.
You want to see a guy who knows what he's doing? Check out Sugar in No Country for Old Men. He's doing it in a nice, clean, sterile setting in his bathroom. Here, he's mixing some betadine into some normal saline as a cleansing solution. He even has this pro tip down, which is make yourself a little squeezy bottle by stabbing holes in the top of the bottle. Closing a laceration on a desert island. Lost.
Do you have a second? I could use a little help here.
Help with what?
With this. Look, I do it myself. I'm a doctor, but I just can't reach
You
it.
sew that up.
Honestly, if I were Jack, I would just leave that wound open for fear of infection. But listen, if you're gonna close it, he's not wrong.
Did you ever patch a pair of jeans?
The sewing technique is actually kind of similar to hand sewing.
For the wound.
And here we are again using alcohol to disinfect a wound. Again, I think vodka would be my personal choice, both for its smoothness and its flavor. Tension pneumothorax, Mad Max.
She's collapsing her lungs, one breath at a time.
I'm so sorry.
Oh my God, that is not how you fix a tension pneumothorax. This is more commonly known as a collapsed lung. Every time a patient takes a breath, air escapes from the lung but is trapped inside the thorax.
She's pumping air into her chest cavity. She's collapsing her lungs.
The classical, standard, and safest way to treat a tension pneumothorax is with thoracostomy drainage or needle drainage in the first and second intercostal space in the mid-clavicular line. If you stab lower, like where Mad Max stabs, you are just as likely to hit something like the spleen or the colon because the diaphragm is moving up and down.
I know.
Safest way is in the chest where there's really nothing else.
I am so sorry.
Now, where they get tension pneumothorax right is here in Three Kings.
Air in his chest, it's crushing his lung.
I pretty much love everything about this clip. I actually think this animation is very good. Here it demonstrates the injury to the surface of the lung that's allowing air to escape into the thorax. Here they demonstrate pretty solid placement of their needle thoracostomy. It's exactly as described, second intercostal space, mid-clavicular line. This is even a little fancier. They have a 3-way stopcock that will allow them to let the air out intermittently. And it's also a great representation that the patient will feel almost immediately better.
I feel better.
How not to do a physical exam on a trauma patient. Twilight.
Bella, looks like you took quite a spill. How do you feel?
Good.
You might experience some post-traumatic stress or disorientation, but your vitals look good. No signs of any head trauma.
He's talking about her vitals, meaning her heart rate or her blood pressure. Meanwhile, he's doing a pretend neurological exam by flashing the flashlight in her eyes. That's not how we do it.
You might experience some post-traumatic stress.
PTSD is not really a diagnosis we make right then and there in the ER. It's something that sort of develops later on in a patient's course.
I think you'll be just fine.
While good looking, this guy is pretty lazy. He's doing a very minimal, superficial check of this patient who apparently just suffered some big traumatic accident.
Sounds like you were very lucky.
Brain death. Grey's Anatomy.
Those must be the papers. The papers you want me to sign to decide what to do with my husband, now that he's dead, but not really dead.
He's dead. He is legally dead. As a clarification, her husband, Dr. Shepard, has just been declared brain dead. The definition of brain death is a legal definition of death. The brainstem is no longer functioning. There is no chance of meaningful recovery.
Do I pull the plug?
The phrase pulling the plug really bothers me because it implies we are stopping taking care of this patient.
Terminate all life-sustaining measures.
When in reality, brain dead is a legal definition of death.
Stop all curative intervention. Remove all the catheters, drains, and tubes.
So I gotta say, Shonda Rhimes broke my little heart with this clip. I think this is a really terrible representation of brain death as described by Meredith Grey, who who herself is supposed to be a doctor.
I'm a surgeon, just like my husband was. I know how this works.
And should understand this complex and very difficult concept.
You want to talk about killing my husband?
Ma'am.
Give me the papers!
Surgical knot tying. The good doctor.
Need a ligating suture around the splenic artery while I make the cut. Can you do that for me before this young lady bleeds out, Honest Murphy?
Yes.
So they're doing a trauma splenectomy here. This is one of the quickest, most straightforward operations in the book. I don't know why they're so surprised that he knows how to do it. It's a pinch, a scoop, and a staple fire. It should not involve everybody stopping to stare. Really nothing to write home about.
Okay, let's move on to the bowel perf.
If you look at this monitor, this is actually a great representation of what a real patient monitor would look like.
Yes!
That top line is your heart rate tracing 130 because the patient is hemorrhaging. Middle line is the patient's SAT. That third line is what's called the end-tidal CO2. That is the amount of carbon dioxide that the patient's body is producing at that moment. And those last numbers are the blood pressure, 84/40. Maybe not good doctor, but good monitor. An understaffed emergency room. Wrongfully accused.
Because of cutbacks, you are the only person on duty.
He's pregnant. Balance and rotate the organ.
You better take a look at this.
No thank you.
Honestly, sometimes it feels like our hospital is this busy and this crazy and we're all swamped as much as this, but I think this is probably a little bit of a stretch. Multidisciplinary discussions. Grey's Anatomy.
I am telling you,
Why is a patient in there and all of you are in here?
No one can agree on what is.
There are definitely conversations that take place between general surgery, orthopedics, neurosurgery, anesthesia.
Dr. Torres is worried about the limbs. Dr. Bailey is worried about abdominal crush injury.
But ultimately, all these people do have to come together and decide what's going to kill the patient first.
We're together on this? Okay, look, everybody stand down.
That's the treatment plan that we should pursue.
We work as a team, or that man dies.
Scary 1970s cerebral angiogram. The Exorcist. So this is an old school representation of how they used to do cerebral angiograms, which is a picture of the blood vessels in the brain. In this scene, you can see them putting a needle into the patient's carotid artery. You can tell it's the artery because there's blood spurting out, threading a wire in, threading a catheter, and then injecting dye and taking x-rays. This dye is a type of contrast, usually with some iodine in it, so that it'll show up on x-rays. Cerebral angiograms are used to diagnose problems with the blood vessels in the brain, such as aneurysms or arteriovenous malformations.
There's nothing there. No vascular displacement at all.
I'm not sure what it has to do with demonic possession, but I'm sure they were just exploring all entities at this point.
We still think the temporal lobe.
Oh, what are you talking about?
Conclusion.
Listen, I get it. Hollywood has to take some shortcuts for dramatic effect or comedic effect, but it's also important to recognize the difference between fantasy and reality.
All right, great.
Great.
It's a wrap.